gentlemen, a very good morning and a warm welcome to the 12th postgraduate course in endocrine surgery. We are deeply appreciative and thankful for your gracious presence. The Department of Endocrine Surgery at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, is a pioneer in the field of clinical practice, training, and research in the area of endocrine surgery. Every alternative year, we conduct the postgraduate course in order to train young surgeons on various aspects of endocrine surgery, which also includes endocrine pathology and endocrine radiology sessions. And this year, we are conducting our 12th postgraduate course. Now I would like to invite all the dignitaries to kindly come over to the dais and grace this occasion by their dignified presence. We would like to take this opportunity to express a hearty welcome to Professor K.D. Verma, ex-head of endocrine surgery, unit and department of surgery, King George Medical University, Lucknow. Sir, kindly grace the dais. May I now invite our director, Professor Rakesh Kapoor, to kindly grace the dais. I now invite our Silver Jubilee orator, Professor Martin Waltz, Professor, Department of Surgery and Center of Minimally Invasive Surgery, Germany, to kindly come over to the dais. We now invite our Dean, Professor Rajan Saxena, to kindly grace the dais. May I now request our organizing chairman, Professor S.K. Mishra, to kindly come over. I now request our organizing secretary, Dr. Gnanchan, to kindly join us on stage. As we know, light symbolizes knowledge and purity. So now I request our dignitaries on the dais to kindly come forward to light the lamp. I also request our delegates, our special faculty, Professor Lee, Professor So, and Professor Redan Zodik, to kindly join us on stage for lighting the lamp. Professor Redan, please join us. Professor Lee and Professor So, please join us.
Good morning and a hearty welcome to you all. Respected dignitaries and the dais, our chief guest, Professor K.D. Verma, who is reputed as the first person to start endocrine surgery in northern part of India, and he has been our advisor and what you call guru in Indian language. All along, still we started department in 1989. Our Silver Jubilee orator, respected Professor Martin from Essen, Germany. Our beloved director, Professor Kapoor, Rakesh Kapoor. Our beloved dean, and also our organizing Dean Professor Rajan Saxena, and organizing secretary Dr. Gyanchan. All reputed faculties invited from overseas, and all the national faculties, and all the delegates from all over the country and from overseas, and all the staff of the institutes, all faculty of the institutes who have been here to grace this inaugural ceremony, all the staff from the School of Telemedicine here, and anybody from press and media also. So we have been organizing this PG course, we call postgraduate course, since quite long, for every 2 years, and this is our 12th edition of this postgraduate course. What is most important point that we always follow is we always introspect, retrospect, and also do postmortem of our course. Immediately after 1 week of this completion of course, we will have a department meeting, we take the feedback. So I will be very fortunate, and our department will be very fortunate, you can give your feedback, advice, how can make this course a little better, palatable, and to reach across your taste. So thank you very much for being here and to attend this course.
Thank you, sir. I now request Professor Rajan Saxena, our Dean, to kindly enlighten us on the academic activities of our institute.
Good morning, everybody. You came here yesterday to a novel experiment in tertiary care health education. We call that Sanjay Gandhi Postgraduate Institute of Medical Sciences. The novelty of the experiment is also manifest in the creation of the first formal department of endocrine surgery in the country and initiation of the first postgraduate specialty education in endocrine surgery in the country in the form of first MCH. I welcome you all to this postgraduate course in endocrine surgery, the 12th one in succession. And I hope that you have a bonanza of surgical education as well as hospitality at your display. Thank you very much.
May I now invite our director, Professor Rakesh Kapoor, to bless us on this occasion.
Good morning, friends. I welcome you all to this postgraduate course in endocrine surgery. Professor K.D. Verma has been my teacher, my mentor, and during my MS, when I was doing post-graduation, the endocrine surgery was confined, what we saw Professor K.D. Verma doing. I feel very proud now, a part of this tertiary care center. The endocrine department, surgery department, which is probably one of the best in the country, and the pioneer in starting this super specialty of endocrine surgery and making it more popular in the country and internationally. We all know about the department. They have young faculty, very dynamic faculty. They have written excellent books. Professor Amit Agarwal, who has edited Atlas on endocrine surgery, the books on endocrine surgeries, and even they started the World Journal of Endocrine Surgery probably from the department, and Professor Amit was the editor of that journal. So I really congratulate this department. They are taking great strides in developing this field, and not only the department, they are conducting these types of workshops in which at least they are initiating the youngsters, the delegates who are coming here to perform these procedures. As we all know, the things are shifting from open surgery to minimal invasive surgery, and the excellent part of this workshop is that you are at least operating patients with the minimal invasive surgery, which our juniors would be stimulated by that, and they will, in the future course of their career, they'll like to adopt these particular procedures. I'm really thankful all the international faculty here from Germany, from Japan, from Korea, and my request with them would be, and the administration would be all supportive to have something, an exchange program with them, so that our faculty, our juniors, our delegates who are upcoming endocrine surgeons, they can have a good view and a good experience of what is happening internationally also. So once again, I really congratulate the Department of Endocrine Surgery, especially in the leadership of Professor S.K. Mishra and all their faculty, conducting such a good workshop and doing such an excellent work in the department also. So once again, thank you.
On this auspicious occasion, it's a great honor to have our Silver Jubilee orator, Professor Martin Waltz, with us. I kindly request Professor Martin Waltz to release the souvenir of this 12th postgraduate course. I now request Professor Martin Waltz to kindly share his thoughts with us.
I think I'm here for the 10th time in India. It started all 2009 when Venkatesh Rao invited me to come to Bangalore. I try to convince you as surgeons to make the world for the patients better. And this is what we should aim all the time and should have in my mind. So thank you very much for inviting me to this beautiful place. Thank you.
It's a great privilege to have Professor K.D. Verma as our chief guest today. I request Sir to kindly share his valuable experiences with us today.
It is a great effort by Professor Gyan to have gone into details of organizing this CME program. CME program for postgraduates is the hallmark of academic activity of any academic institution. And this very vibrant and easily the best department of endocrine surgery in India is holding this program every 2 years regularly. I wish all success to this CME program. My best wishes to you. Thank you.
I now request Dr. Gyanchand to deliver the vote of thanks.
It's my proud privilege to have been asked to propose a vote of thanks on this occasion. At the outset, I would like to express my profound gratitude to Professor K.D. Verma, our chief guest, for sparing his valuable time to address the gathering and highlighting the issues that we need to deliberate during the course. So these will also form the basis of deliberation during our 2.5 days conference. I would like to express my sense of obligations to Director of our institute, Professor Rakesh Kapoor, for his kind guidance for this event. Thank you all again, and we would like forward your extremely productive 2.5 days discussion. Thank you very much.
It's a great privilege and honor that Professor Martin Waltz, Professor, Department of Surgery and Center of Minimally Invasive Surgery, Germany, has agreed to deliver the prestigious Silver Jubilee lecture. I request Professor S.K. Mishra, our Head of Department, to introduce our Silver Jubilee orator.
I've been asked to introduce you to this year's Silver Jubilee oration. I just want to say a few words about the Silver Jubilee orator, but about the Silver Jubilee oration, I'd like to just give a little introduction to that, because our department completed 25 years. It is 1989, so 2014. So after that, we have instituted this Silver Jubilee oration, and we invite eminent personalities who are contributed to endocrine surgery as the Silver Jubilee orator. So in this year, we have decided in our department with the concurrence of all the faculty members to get this Silver Jubilee oration to award to Professor Martin Waltz. I'm sure all of you agree that there is no second choice for this oration. But at the same time, I can just only put a word at the last concluding comment about Martin Waltz. At the end of his lecture, he will make all of you convinced that this is the only approach we should learn. So with that introduction, I request Martin Waltz to give this year's 2015 Silver Jubilee oration for our department. Thank you very much.
Saroy, thank you very much for these nice words. Some of them I did not realize that it was like this in the past, but I think the individual view on the history is maybe a little bit different than the objective. I'm happy to be here, as I said before, and I would like to invite you to understand why this happened, what you saw yesterday. Yesterday you realized that we did a special type of surgery, and the special type of surgery was to go to the adrenal gland. The adrenal gland, which is a retroperitoneal organ and is approached by an extraperitoneal approach. So, can I ask you how are you doing this morning?
I'm feeling fine, no problem, nothing, no pain, nothing I'm feeling now.
So next time you would come back for this operation to Lucknow? The problem is he has only 2 adrenals, and so we can't remove another one without any functional deficit. So this is just what I wanted to show you in the beginning. He operated, it's less than 24 hours ago, and there is nothing left. And thank you very much again.
Thank you.
So, Italian patients on day 1, it's the same as in our patient situation. Thank you.
I wish to invite the patient who got benefit out of this surgery to be here, and I request all my department colleagues, faculty colleagues to come and join me in felicitating Professor Martin, this year's Silver Jubilee laureate.
Good morning. After the phenomenal lecture by Martin, we move on to the next gen, that is from retroperitoneoscopy to robotic. And the keynote lecture on how to develop robotic surgery training program is by Professor E.Y. So from South Korea.
So is the president of the next year Congress of the Asian Association of Endocrine Surgeons. So he is the chief of surgery in University of the Seoul in Korea.
I'm very happy to be here for 12th postgraduate course in endocrine surgery. I was very impressed about this well-organized training program and this well-organized facility too. Maybe I learn more and get many ideas of your systems. I have a title, how to develop robot training program. Even though I performing robot surgery, it's the first time to teach the how to develop the program subject. So I'd like to thanks for your kind attention. Thanks very much.
Good morning, and I really want to thank Professor Mishura and Professor Agar and Professor Gant to have me here this beautiful and very wonderful conference. Today I will talk about the robotic thyroid surgery. This is my the hospital I came from, the Seoul National Hospital. Very beautiful mountains nearby. I will talk about the few topics. Thank you for your attention, and Dhanyawad.
Professor Mishra, at first I'm very happy to be here, and thank you for inviting me for this excellent course. Was for the privilege and honor to perform the open surgery and to present one simple technique of sentinel lymph node biopsy. So it was the first.
After 3 days of intensive mind-rattling academic sessions, a warm welcome to the cultural program of the 12th postgraduate course in endocrine surgery. we would begin this program with the auspicious lamp lighting. I request Dr. Arindam Bhattacharya, our Additional Director, to kindly come over the stage for the lamp lighting. I also request Professor C.L. Katrapal, Professor Redan, Professor Riaz Ahmad, Professor Ajay Bandarwarkar, Professor S.K. Mishra and Dr. Gnanchan to kindly come over the dais for the lamp lighting. Today, we are greatly honored to have Srimati Kalaimamini Padmini Dorairajan and her troupe with us. Now, I request Srimati Padmini Dorairajan to give us a brief introduction of her dance performance.
Namaste to you all, ladies and gentlemen, and a very good evening to you all. It gives me great pleasure to stand here before you all this evening to present my style of dance, which is the traditional classical style of South India, Bharatanatyam.
Dr. Kirti Catherine Kabir, Kumari Subiksha Arani, Kumari Kavya,